Alanine aminotransferase, aspartate aminotransferase, and alkaline phosphatase are crucial enzymes that play significant roles in the body's metabolic processes. These enzymes are primarily found in the liver, but also present in other tissues such as the heart, muscles, and kidneys. ALT and AST are pivotal in amino acid metabolism, facilitating the conversion of alanine and aspartate into crucial metabolic intermediates. ALP, on the other hand, is involved in dephosphorylation, playing a vital role in processes like energy transfer and signal transduction. Measuring the levels of these enzymes in the blood provides valuable insights into liver function and overall health, aiding in the diagnosis of various conditions, including liver disease, heart conditions, and bone disorders.
Alkaline phosphatase, ALP. Alkaline phosphatase or ALP is an enzyme found in various tissues throughout the body, with the highest concentration in the liver, bones, kidneys, and bile ducts. It plays a crucial role in dephosphorylation, a process that removes phosphate groups from molecules. Function. ALP facilitates the breakdown of phosphate groups in protein and other molecules, enabling cellular processes such as energy transfer, metabolism, and signal transduction. Location in the body. Liver and bile ducts. ALP levels are high in the bile ducts and help facilitate bile production. In the bone, osteoblasts, bone-forming cells, produce ALP, important for bone mineralization. In kidneys and intestines, also contribute a smaller amount of ALP. There are different kinds of ALP. They say isoenzymes. Liver ALP, bone ALP, intestinal ALP, or placental ALP. It's elevated during pregnancy. Clinical significance, normal ALP levels. The normal range of ALP varies by age, sex, and testing method, but typical adult level are 40 to 140 units per liter. Children have higher levels due to active bone growth. Elevated ALP, hyperphosphatemia. Causes include liver disorders, hepatitis, bile duct obstruction, or liver cancer. In bone conditions like osteomalacia or bone fractures. In pregnancy, we have increased ALP especially in the third stage of pregnancy, and other status in hyperparathyroidism, certain infection, or malignancies. But low ALP or hypophosphatemia causes include is a disease or syndrome as named hypophosphatemia, a rare genetic disorder disaffecting bone development, in malnutrition, particularly zinc or magnesium deficiency, in thyroid dysfunction, in hypothyroidism, in certain medication such as using corticosteroids. Testing for ALP. Why is it tested? ALP testing helps evaluate liver function, bone health, and investigate gastrointestinal issues or unexplained symptoms such as fatigue, jaundice, or bone pain. How is it tested? ALP levels are measured via blood test. Fasting may be required as recent meals can temporarily raise ALP, especially intestinal isoenzymes. Additional tests. To determine the source of elevated ALP, other tests such as GGT, gamma-glutamyl transferase, or ALP isoenzyme testing may be done. Factors affecting ALP levels. The first is age. Children naturally have higher levels due to bone growth. In pregnancy, placental ALP increases during pregnancy, especially in third stage. In diet and lifestyle, a high-fat meal can transiently raise ALP levels. Alcohol consumption can affect liver ALP. And using some medications, drug like oral contraceptive and hepatotoxic drug, and some medication like corticosteroids influence ALP levels. Management and follow-up. Elevated ALP. Treatment focuses on addressing the underlying cause, such as liver disease or bone conditions. Further imaging, like ultrasound for liver, or testing like calcium, phosphate, or vitamin D levels may be required. But in low ALP, often related to dietary deficiency or metabolic conditions, and managed with proper supplementation or treatment of underlying issues. For personalized interpretation of ALP levels, consult a healthcare provider.
Enzyme name is aspartate aminotransferase. It is an enzyme found in various tissues throughout the body with the highest concentration in the liver, heart, muscle, and kidneys. It plays a crucial role in amino acid metabolism and the urea cycle. It has many functions such as conversion of aspartate and alpha-ketoglutarate into oxalated and glutamate, crucial for the urea cycle and energy production process within the cells. It's found in liver, high level in the liver cells due to its key role in amino acid metabolism, and it also found in heart, muscle, kidneys. It has two types, cytoplasmic AST and mitochondrial AST. Cytoplasmic found in the cytoplasm of cell, and mitochondrial found in the mitochondria. It also has the normal range of AST varies by age, sex, and testing method, but typically adult level are 10 to 40. It has many causes also, which include liver disorders, and the disease examples are hepatitis or liver cancer. Uh, the low AST causes include vitamin B6 deficiency, which is necessary for AST function, and also chronic kidney disease, which reduce enzyme activity. There are many testing for AST is there. And AST is tested because AST helps evaluate liver health, diagnose heart condition, and investigate muscle damage or unexplained symptoms such as fatigue, weakness, or jaundice. How it tested? AST level are measured via blood test. No specific preparation is usually required, but avoiding strenuous exercise before testing may be recommended. Factors affecting AST level: age, physical activity, diet and lifestyle, medications, and etc. Elevated AST treatment focuses on addressing the underlying cause such as liver or heart condition, or low AST related to nutritional deficiencies or chronic conditions and managed with proper supplementation or treatment of underlying issues.
Alanine aminotransferase, ALT, is an enzyme predominantly found in the liver, with smaller amounts present in the heart, muscles, and kidneys. It plays a vital role in amino acid metabolism. ALT's primary function is to catalyze the conversion of alanine and alpha-ketoglutarate into pyruvate and glutamate. ALT is essential for the production of energy and the function of the urea cycle. The location in the body where ALT is primarily found is liver, so high levels in liver cell due to its significant role in amino acid metabolism. Present in the heart and the cardiac muscles, contributing to overall heart health. It's also found in the skeletal muscle cells, aiding in muscle metabolism. It's also found in kidneys, as it supports the kidney function. It's an isoenzyme type, and the cytoplasmic ALT predominantly found in the cytoplasm of the cells. For the clinical significance, normal ALT levels varies by age, sex, and testing method, but typically adult male levels are 7 to 56 microliters, and normal typical for adult female is 7 to 35 microliters. Elevated ALT or hyperalaninemia causes can include liver disorders like hepatitis, fatty liver disease, cirrhosis, or liver cancer. Heart conditions also includes myocardial infarction, muscle injury, or myopathies of muscle injuries throughout the body. Other causes could also include alcohol abuse, certain medication, or metabolic syndromes. Low ALT causes could be due to vitamin B6 deficiency, necessary for ALT function, and chronic kidney disease, reduced enzyme activity. Why is it tested? So the primary test, ALT test, helps evaluate liver health, diagnose liver diseases, and investigate muscle damage, or unexplained symptoms such as fatigue, nausea, or abdominal pain. ALT levels are measured via a blood test. No specific preparation is usually required, but it's advisable to avoid alcohol and certain medications before testing. Additional tests to determine the source of elevated ALT, other tests such as AST, aspartate aminotransferase, or liver function tests, LFTs, may be done. Factors affecting ALT levels could include age. Older adults may have slightly higher levels due to cellular aging. Physical activity. Strenuous physical activity can temporarily increase ALT levels. Diet and lifestyle. High protein intake and alcohol consumption can influence ALT levels. Medications, drugs like statin, aspirin, or acetaminophen can also influence ALT levels. Management and follow-up for elevated ALT treatment focuses on addressing the underlying conditions such as liver disease or heart condition. Further imaging such as ultrasound or CT scan or testing may be required. Low ALT, often related to nutritional deficiency or chronic conditions, managed with proper supplementation or treatment of underlying issues.
In summary, ALT, AST, and ALP are essential enzymes with distinct but interrelated functions that are crucial for maintaining metabolic health. ALT primarily facilitates the conversion of alanine, while AST is key in the metabolism of aspartate, both supporting the urea cycle and energy production. ALP's role in dephosphorylation impacts various physiological processes, including bone mineralization and bioproduction. Elevated or decreased levels of these enzymes can indicate underlying health issues such as liver disease, heart conditions, or bone disorders. ALT and AST are often tested together, and the ratio of AST to ALT is compared in laboratory settings. This comparison helps differentiate between different types of liver disorders and assess the severity of liver damage. For instance, an AST-ALT ratio greater than 2:1 is often indicative of alcoholic liver disease, whereas a ratio less than 1 might suggest non-alcoholic fatty liver disease. Comparing these enzymes levels provides a more comprehensive evaluation of liver function, aiding in the accurate diagnosis and management of liver-related conditions. Regular testing and monitoring of ALT, AST, and ALP levels are vital for early detection and management of potential health problems, ensuring timely medical intervention and better health outcomes.